There were some things that Dr. Fauci had said toward the beginning of the AIDS epidemic that didn't end up panning out. So one was that he warned that he thought that routine close contact among family members could potentially spread AIDS. Now, he corrected that within about a year, which was noted as sort of very fast for anything that you're publishing, in a medical journal. If we contrast that to what happened with a more recent public health emergency, where he had made some comments, ironically, saying about, didn't expect that there was asymptomatic spread, didn't think necessarily that masks were needed. He corrected that a whole lot faster as the data became available. But in this era of social media, where there's, instant analysis and everyone's all of a sudden, an expert, plus you have, people, especially in the Senate, from the other party that, or from the president's party at the time, that are ready to attack you, and it's a whole different ball game. Plus, with the lack of effective leadership from the very top, he really got himself into a bad spot.
Yeah, I think that there is a really interesting, and Peter Hotez mentioned this in one of our earlier, Dr. Peter Hotez earlier podcasts. There is a demonization and political backlash for anybody who's going to be sort of taking, there's a reason why we have the Statue of Liberty, not the Statue of Social Order in New York. I mean, we are a country of people that fervently and sometimes violently protect their own personal liberties. And so, obviously there's going to be politics associated with public health because it's public health. But science is not perfect. It is an evolving narrative of the truth as we know it right now. And there will be inconsistencies if we are actually continuing to do research to tune up and improve what we know to care for and heal more people. I do think that one of the challenges in public health is finding a way to frame the fact that this is the truth as we know it right now, but perhaps not the final or the ultimate truth, because otherwise activists on any side will assume that inconsistency means insincerity or dishonesty, and it doesn't. It often just reflects the facts of the moment.
Well, John, I think, this isn't about Dr. Fauci specifically, but if we look at the whole public health establishment and why, for example, the Centers for Disease Control wasn't so well prepared to deal with a recent public health emergency, it's that they are used to saying, okay, here's a problem, I'll go study it and I'll come back and I'll tell you the answer once I've had a chance to properly analyze it. Now, that leaves a big vacuum when people need information to be able to act on. And then if you sort of say what the truth is at the time as you know it, it leaves you vulnerable to or inconsistent or whatever later. Now, I think the public health agencies can do a better job, but it's also the case that others are looking to attack. And that's only partly what the public health agencies can do. We also need some goodwill from others. It was interesting what Dr. Fauci said in his goodbye press conference. And he said, this is a quote, "When I see people in this country, because of the divisiveness, not getting vaccinated for reasons that have nothing to do with public health, as a physician, it pains me. I don't want to see anybody hospitalized. I don't want to see anyone die. Whether you're a far right Republican or a far left Democrat, it doesn't make any difference to me."
Yeah, I mean, the reality is he was beloved and respected by Reagan and the Bushes, and he was beloved and respected by Obama and Biden and Clinton. I mean, this is a guy who's not political at all. And I think one of the interesting things and challenges for Dr. Fauci, who we got to just thank him for his service. That's a long service for all of us, and for his amazing achievements. He really is actually one of the better communicators I've ever seen on public health issues. He comes across very sincerely and believable.